Hi, my name is Stephanie Lindamood. This is my review of the literature for research design in nursing. The topic I've chosen to discuss is sepsis. Here is a definition that I pulled from sepsis.org to describe exactly what sepsis is. It has become a very expensive illness to treat. As nurses and nurse practitioners, it has become very important that we understand and recognize and know when to intervene in a sepsis patient. There are a lot of evidence-based practice articles out now that are documenting the importance of early interventions for the diagnosis and treatment of sepsis. At this point, nurses are still not sure when they are supposed to intervene and what their role is in initiating sepsis bundle protocols. So the purpose of my study is going to be to implement an understanding of the role of the APN for the management and the treatment of a patient that has been diagnosed with sepsis. I'm planning to use Patricia Benner's theory from novice to expert to guide the study framework for this project. Here are some databases that I used for my search, as well as some keywords and subject headings. I was looking for articles specifically that explain sepsis, explain bundle implementation, and looking for articles that provided some recommendations to improve the bundles, whether it be through education, the role of nurses specifically, and I was also looking for some articles that help discuss the nurses' understanding of their roles in the sepsis bundle implementation. All of the articles that I pulled are supportive in the education, diagnosis, and prompt treatment of sepsis. Early goal-directed therapy was a very common discussion in all of the articles that I used. These articles provided a lot of recommendations. They provided knowledge and education towards the practice and the early intervention for sepsis management. The target populations I used were specifically just adults meeting the criteria for the diagnosis of sepsis and septic shock. There are a lot of evidence-based practice journal examples that I used, and I also included target populations that included the staff that would be implementing these sepsis bundles, whether it be nurses, physicians, or a team-based approach. About 4 of the articles I used were research-based journal articles, and they used a lot of research design studies where they just pulled literature from several different areas to determine what helps in sepsis, what's working, what's not working, what are the barriers, and what can we do to improve the outcomes on these patients. I used several other articles that were mostly perspective designs, and they included a lot of pre-post interventions, whether it be with surveys or documentation. There was one article I used for nursing students, and they did a pre-interview on what they knew about sepsis. They then did a simulation, and then at the end of their simulation for sepsis, they had another interview, and all of the nursing students felt more comfortable going into the hospital once they graduated, knowing how to recognize a septic patient and when they should intervene. There were other articles that included nursing and their barriers to implementation, as well as strategies for improvement in the management of sepsis. Every study that I chose, whether it be for the review of literature or not for this particular project, found in favor of early treatment, early diagnosis, early recognition of septic patients. And early goal-directed therapy is a priority in these patients. The articles that I did choose for my review of literature had a lot of recommendations for improvement in the nursing standpoint, whether it be through education, research, or practice, and all provided the strong findings for the early intervention and management of sepsis. There were multiple conceptual frameworks used. Each literature review had a different type of framework that they used to help them collect their research for their study. For example, one used a grade recommendation, which rates the evidence from high, which would be an A, to very low, to a D. And then they rate them with a grade 1 or a grade 2, depending on the benefit for the population. Another study used the Downs and Black checklist, and they used the behavior change wheel, behavior change technique. This was my article by Steinmo, and they used several different theoretical techniques to help with a clinical care bundle for sepsis. You'll see a lot of the Surviving Sepsis campaign for my project. That is the basis for almost every single journal article I've used or seen. SurvivingSepsis.org has a lot of information, and that is where the Surviving Sepsis campaign has been launched. And a lot of them use this framework for the basis of their study when they're developing their research to determine what helps. As I mentioned before, all the articles that I have reviewed support early intervention of sepsis. The inconsistencies vary on the best ways to achieve early intervention in the nursing community. How do we educate the nursing staff? How do we make sure that a nurse recognizes sepsis and relays it to the physician? Making sure a physician evaluates that patient. There are several studies. Do we do a team versus a non-team based approach, where we incorporate a sepsis team to determine if a patient is septic? There's just so many gray areas of sepsis that there's clearly a need for defining what it is we need to do as nurses and APNs to best make sure these patients are taken care of. There were several limitations in my articles. Many just had very small sample sizes. They may have only used one hospital for their reviews. One article not at all mentioned that a lack of educational resources and socioeconomic status may have limited the outcomes. For example, CVP monitoring is recommended for septic patients, but maybe this particular hospital doesn't have that luxury to monitor CVP on those patients because of their socioeconomic status. It may be a poor community that can't afford the type of medical equipment that the patients need. Some were just observation studies and no interventions were available to determine if the outcomes improved. That was also a limitation of my review. The gaps that I found in my article really solidified the need for more studies for nursing and the management of sepsis. I listed some examples here of the literature or of the studies that I used for my review that discuss the need to improve the role of the nurses in sepsis management and care. In conclusion, there's definitely a gap in the nursing community regarding the implementation of the sepsis bundles. We need to make sure that we get these barriers identified so that we can be 100% compliant on managing these patients. And just to also mention, sepsis is not just a problem in the United States. When you look over survivingsepsis.org, you'll see statistics from the United States. But the articles that I used for my review really had problems globally. I used one from Asia, there's one from the Netherlands. This is not just a problem here. So this is a priority worldwide to making sure that we are treating these patients and reducing mortality. As I mentioned before, there's multiple articles that note the gaps in the nursing process for the care of these patients. I think that it's really important to make sure that the educational training program for sepsis is correct and that nurses understand it. By using Venner's theory, I think that this would be a good way to help the nursing staff become an expert in the recognition and intervention of sepsis. So by providing a clear formal guideline for implementation, the goal is just to improve the compliance rate significantly among the nursing community, hopefully for a reduction of morbidity and mortality among these patients. And that's it. I thank you for listening, and if you have any questions, feel free to email me.